Hello and welcome to the UCLA Psychiatry and Semel Institute Grand Rounds. Today we're welcoming two renowned psychiatrists who are serving the world, Dr. Richard Brown and Dr. Patricia Gerbarg. My name is Helen Lavretsky. I'm the Director of the Integrative Psychiatry and Director of Research of the Integrative Medicine Collaborative at UCLA. We'll be moderating this discussion. Both Dr. Brown and Gerbarg are pioneers of integrative psychiatry. They started way back when it wasn't popular. And they built up a large number of publications. They now have a nonprofit foundation that trains, Breath, Body, Mind Foundation that trains facilitators of breathing-based interventions. Dr. Gerbarg is an assistant clinical professor of psychiatry at New York Medical College, specializing in integrative psychiatry. She is a graduate of Brown University, Harvard Medical School, and Boston Psychoanalytical Institute, and co-authored over 75 publications, multiple books, How to Use Herbs, Nutrients, and Yoga in Mental Health, non-drug treatments for ADHD, Rhodiola Revolution, and also the first textbook published by APA on integrative psychiatry. And she's done seminal research in mind-body practices for stress, trauma relief, and in mass disasters. Dr. Brown is an associate clinical professor of psychiatry at Columbia University, specializing in psychobiology, psychopharmacology, and integrative psychiatry. He completed his MD at Columbia University and psychiatry residency and fellowship at New York Hospital, authored 100 publications. For the past 20 years, they worked together. He is a certified teacher of Aikido, yoga, open focus meditation, and Qigong. The three of us have done numerous conferences and workshops, including during long COVID. And I always admire their professionalism and deep knowledge of integrative psychiatry. I admire their dedication to saving the world via breathing and other integrative medicine techniques. They trained 2001 World Trade Center first responders. They worked all around the world in conflict zones, South Sudan, Ukraine, Israel, Rwanda, and COVID and earthquakes and floods and you name it, they serve it. So please welcome Dr. Gerbarg and Dr. Brown.
Thank you, Dr. Lavretsky, for that excellent introduction, and we appreciate your support and your invitation to be here. I'm going to just take a moment to share my slide set so that we can get started. And in about 20 minutes, Dr. Brown will join us and lead you in some of the practices that we found to be the most helpful for people during and after disasters. So we call our program the Breath, Body, Mind program. And use it for pretty much every disorder. We don't have time to go into details on all, but I want to give you a taste of some of the things that we've been able to do. We do get remuneration for some of our programs, but most of our work now is pro bono. The basic principle is the relationship between breathing and emotion. Studies have shown that voluntarily changing the way we breathe, as opposed to automatically breathing, can have a major effect on our emotions and on our thoughts. As you know, the autonomic nervous system has two main components, parasympathetic and the sympathetic. But beyond regulating all the internal glands and organs, these systems also have major effects on our behavior, our emotions, and other aspects of our relationships. And it's been found more recently, the autonomic nervous system, which is also the anti-inflammatory part of our nervous system, and it restores our energy reserves, but it's also believed now to be involved in social engagement, how we relate to one another. The most common imbalance in the autonomic nervous system is one of overactivity of the sympathetic branch and actually underactivity of the parasympathetic branch. So all the medications we use to reduce anxiety will dampen down the activity of the sympathetic system, but they don't strengthen the parasympathetic system, so we still have an imbalance. We found the simplest and fastest way to bring about a true balance is through slow breathing practices, and the one that we focus on is called coherent or resonant breathing, because that does reduce the overactivity of the sympathetic system, and it also activates and strengthens the parasympathetic system. So everything just works better. Now, the vagus nerves are the main pathway of the parasympathetic nervous system, but only about 20% of the fibers are needed to regulate the internal organs and glands. About 80% of the fibers are carrying messages, interoceptive messages about the internal state of the body, carrying messages from the body up to the brain. When we do slow breathing, we are activating these pathways. So briefly, you can see the lungs here are one of the many organs. The vagus nerve is bidirectional. Every time you breathe in and every time you breathe out, millions of messages are being sent from stretch receptors, chemoreceptors, pressure receptors, all of that being sent up the vagus nerve. And it goes through relay stations in the brain stem. From there, it ascends to all the major regulatory areas in the brain. So one branch goes to the limbic system and has an effect on the functioning in the amygdala and the hippocampus. Another branch goes to the hypothalamus at the head of the HPA axis. Another branch goes to the thalamus, which has connections over the cortex through its projections to the prefrontal cortex and other areas. There's a lot of crosstalk going on, and it affects the rhythms that are set for the brain waves. Okay. Interoception is the perception of feelings that reflect the internal state of the body. And this is one of the pathways coming up through the brainstem. You can see that part of it goes through the thalamus and up to the anterior cingulate, where it impacts higher level judgments, deciding on risks and dangers and so forth. Another branch goes to an area that's being called the interoceptive cortex, the insular cortex. And there it's believed to be a place where a map of the information is laid down and then processed through numerous layers, integrating all kinds of other information, including sensory input from the five senses and so forth. There's a lot going on here. And then it connects with higher levels. So it becomes involved in all of our thinking processes, planning, executive functions, and many other things. So basically, by voluntarily controlling our breathing, we have a portal through which we can access the interoceptive communication pathways of the brain. And changes in the breathing pattern change the interoceptive messages. And this can bring about rapid changes in the mind and emotions. And what's also interesting about breathing is that it's the only autonomic function that can be controlled either voluntarily or it happens involuntarily. So the breathing messages are especially powerful and rapid because breathing is such a vital function. The brain is receiving millions of messages all the time, but the greatest attention has to be given to breathing messages or changes in breathing. And this might account, excuse me, in part for how quickly the breathing can have its effects and how widespread those effects can be. The brain listens to the lungs. A number of studies are showing that the pattern of breathing can actually entrain the electrical activity of the brain as seen on electroencephalograms. And this effect is especially strong in the insula, amygdala, and other frontal and temporal areas. We've also looked at the effects on GABA, the brain's main inhibitory neurotransmitter, there are pathways going to the amygdala, GABA pathways. And we studied the effects on GABA levels with Drs. Chris Streeter at BU. This was a study of patients with major depression who were given a 12-week program. Half the time was yoga and half the time was coherent breathing. And you see that as the number of minutes they practice breathing goes up, their scores on depression go down. Here you can see these red voxels are in the location of the thalamus. And what we found was that baseline GABA levels were low, which is common in major depression. And after 12 weeks of practicing, the levels were increased, area under the curve. And then when an acute practice was done, there was a further increase. So this was the first study showing an effect of these kinds of practices on a neurotransmitter. So we teach people to do breathing, including coherent breathing, first with their eyes closed and then with their eyes open, so that they can do it even when they're outside their home or taking a walk or in a stressful situation. They can simply go into quiet, coherent breathing. No one knows that it's being done. And so that person can stay calm and collected and not get anxious and not freeze while everyone else is pulling their hair out. You want to be that person who's doing your coherent breathing. It's very good for exam stress in students as well. This is one of our studies. It was a randomized controlled trial of our breathing program. One of the original parts of the breathing program we did. We've brought about a number of changes since this was done. This was a study of 25 Australian Vietnam veterans who were 100% disabled despite having received every possible treatment that the VA could give them. They were 100% disabled due to PTSD. They were heavily smokers and drinkers on multiple meds. They had many problems, and Dr. Brown gave them a 6-day program. And after 6 weeks, their scores on the CAPS, which is the gold standard for PTSD studies, their scores went down 14 points. This is a substantial drop and indicates an effect size of 0.91. And about 6 months later, they were given like a monthly practice session if they wanted to come. The scores had dropped even more to the point where many of them no longer qualified as having PTSD. And one of the veterans said, if we'd gotten this when we came back from Vietnam, we wouldn't have lost 30 years of our lives. This is Bilal Ahmed. He was a physician from Pakistan who came over and trained with us. And then he was actually a medical student originally. This is a video he sent us during his first year of his internship working on an intensive care unit at the height of COVID.
Hi, my name is Dr. Bilal and I'm an acute care doctor here in Karachi, Pakistan. So in the current corona pandemic, we're facing a lot of uncertainty and stress. We're short on PPEs, we have patients crashing, and it just gets really overwhelming at times dealing with these things and trying to manage patients in the correct way. So one thing that's really helping me stay focused is the coherent breathing that I do sometimes during, like with my mask on, and other times in my breaks. And it really helps me to stay centered and grounded and to be able to do my job right. And I feel that as healthcare providers, we are really burning out at this time. And I think this is something that we should be learning the skill to breathe at 5 breaths per minute. And it will really help us get through the stress we're facing and perform better so that we can serve the community better.
What you're seeing here is part of a group of 400 South Sudanese. As you know, there have been extensive wars between North and South Sudan. And over the years, many captives were taken by the militias that invaded South Sudan. And they burned villages, they tortured people and so on. And they took back people and kept them in abject, brutal slavery some of them for 10 or 20 years. Many have been returned, and you're seeing here a group of 400 being brought back to South Sudan. They've walked for about a week through the jungle and with very little food or water, carrying some of their babies and children. And they've just crossed the border into South Sudan, where there's a clinic. The philanthropist who runs the clinic had found that by doing some of our practices, she was able to help these people to some extent. So she brought Dr. Brown over to South Sudan to meet this group of 400 people as they were arriving. And you can see they're utterly exhausted, and they sit down and wait. He's given 20 minutes to work with them. And I'm going to show you part of what happened during those 20 minutes.
So let's tell them that we're going to do special breathing to help them start healing process.
Hey.
What I do with my hands as they breathe. Okay? So hands here. And breathe in. Bring the hands up. Continue to breathe in. Hold the breath. Arms stretched. Good. Hold the breath, hold the breath, hold the breath. And breathe out. 2, 3, 4, 5, 6. Pause. Breathe in. Hold the breath. Breathe out. One more. Breathe in. Hold the breath. And breathe out. Relax a moment. Eyes closed. Just being very still. So let's tell them that. And breathe. 5, 6. Pause. Breathe in. Breathe out. Breathe in. All together. Breathe out. Go ahead. Breathe in. Go ahead. Breathe out. Go ahead. And relax. Hey! Let's celebrate your independence. Hey! Let's do it together. Hey! I'm with you. Hey! 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 That's good.
So that was quite an effect. There were 19 women there who participated in a small study that was done. in which they came to the clinic 5 days a week for about 18 weeks. And the clinic staff led them through breathing practices for about half an hour or so each of those days that they were there. I had to create a visual analog scale because they don't read and they don't even have a counting system. But they were able to mark on a line the intensity of their symptoms. And it basically followed the PTSD scale. So what we saw, the change from baseline, this is their PTSD scores and their mood scores, by 6 weeks were very significantly improved. And by the end of the 18 weeks, we're looking at 71 and 66%. They then asked Dr. Brown to teach them to be the teachers for South Sudan. And he did do that in a period of about a week. And since then, they've been going to the villages and orphanages, which are extensive, teaching the breathing practices. In Rwanda, Dr. Niyonzima has developed a very innovative program for community mental health, which is based in the breath, body, mind. So we've been training a number of teachers there. And he basically uses breath, body, mind with collective narrative and local rituals. And all of this is delivered by community healing assistants. So when we're thinking about serving large groups of people with very little resources and very little infrastructure, this works beautifully. He followed quite a number of them, as you can see, almost 2,000, and there are many more since then, and found about a 58% reduction in depression, a decrease in anxiety, and about a 64% reduction of PTSD. There was an improvement in their productivity and school attendance, but this is the statistic that really struck me. 59% decrease in intimate partner violence, which, as you know, is epidemic and very hard to treat. I haven't seen any program with this kind of success. And he's now almost completed a large randomized controlled study that we hope will be published sometime this year. He then took the program to a high school for at-risk kids in Kigali, Rwanda, kind of kids who would end up in gangs, and taught the kids to be the teachers. And they did this program 1 hour a week for about 10 weeks. And again, he found very impressive reductions in social phobia, extreme anger, which they often had, inability to sleep, and reduction of suicidal thoughts. This is a study that we did at the Regional Integrative Support for Education in Northern Ireland with their staff. They provide all the services for children with special needs who are mainstreamed into the public school system. And at the height of COVID, their agency was under the most extreme stress. I don't have to tell you why. I'm sure you're aware of all the stresses. And of course, with the children and families, kids with special needs, the stressors were having even worse impact. So we provided them with a 12-hour program that we do in 3 days, 4 hours a day. And what we found, first of all, was on this stress overload scale, they began at an elevated level their sense of personal vulnerability. The red line shows you a normative range. So after the 3 days program, it dropped. But then after the 6 weeks of practicing, it went even better. The same for the other scale on the SOS. This is the sense of overload. Their sense of work overload was quite high. It came down actually below the average sense of work overload, even though they had the same amount of work and the same amount of stress. They didn't feel as overloaded. And this shows a combination of those two scales. In this quadrant, it indicates a high likelihood of developing a stress-related disorder. And you can see that most of them were in that category. After 6 weeks, most of them had migrated to the lower range of stress and the lower rate of stress-related disorders. Their sense of tranquility went up. Their sense of exhaustion went down because when you turn off the sympathetic overdrive, which is burning energy, you save a lot of energy. And you turn on the parasympathetic system, you create energy. Since the large-scale invasion of Ukraine by Russia, we've been able to train over 350 psychologists and other mental health workers as breath, body, mind teachers who have been working with the populations around them. This is one of the psychologists who work with us. She is with the Emergency Services of Ukraine. She's a major, I believe, in that service. And you can see her here. She's using breathing for the emergency rescue crew who've just returned from a bombing scene at a mall where there were many deaths among the civilians, to de-stress them. And here she's in a bomb shelter during an air raid alert, teaching a group of children. And we use a little stuffed animal that we call a breathing buddy to teach them coherent breathing. One of the Ukrainian psychologists who came to us experienced significant improvements in her own sleep problems and physical pains when she did our program. She also stopped her son's panic attacks. And then she volunteered for 2 weeks at a local school where she spent 7 to 10 minutes in the classrooms and about 2 half-hour sessions with the teachers, was able in that way to teach about 500 children. Before that, she had been there, they would get very upset, quiet, or freeze during the air raid drills. But when she taught them, there you can see Dr. Vengar and the students are learning one of their practices, which are fun and games for them. And here they are on their way to the bomb shelter. They're no longer upset. They're doing their breathing instead. And here is a classroom underground in the bomb shelter where they're doing some more of our breathing exercises. We also have a program within a couple of weeks after the major earthquake in Turkey, we began a program there. And we had already gotten a few people trained in Turkey, and they then accelerated the program. They went out to the schools and anywhere they could find people. They were working with people in the rubble and the shelters. This is one of the young teachers who worked with these children for several months in a children's home. And she described them as changing from frozen states to becoming interactive and playful again. And we've worked with other groups of refugee children who come from extreme situations of violence and then are able to respond to the breathing practices. We've started a program in Israel, and we're working on the beginning of programs for Lebanon, Palestine, and Syria, which is very challenging, as you can imagine. But there's so many places on the planet that are in need of these services right now. And we welcome anyone who wants to assist us in reaching these difficult areas. We would appreciate your support. This is our original book, The Healing Power of the Breath. And I think I'll stop here so that Dr. Brown can lead you through some practices, and then we'll come back for Q&A.
It's great to see Dr. Loretsky and to be with you all again. So each round of movement, breathing, and relaxation helps repair different parts of the autonomic system. Years of research in Norway have shown that imbalance of the autonomic system is the final common pathway to disease, mental and physical. So this helps you physically as well as mentally. So I want to take you through a short sequence. We can go into greater detail if you come to some of our teacher training programs, but we feel that everybody in the world is quite stressed right now, and it's important to have tools so you can work better. And the breathing improves heart rate variability, which is the best predictor of health and longevity we have at this point. And the research in Norway has shown that not only does your body work better, but your brain works better to solve more complex problems creatively. So pretend you're 4 or 5 years old, and it's an adult Simon Says, where you're just going to do whatever silly thing I'm doing. And we will see what the experience is like. If you can stand up where you are, that would be great. And hopefully we'll have some time to ask questions as well. You could be doing this sitting. You could be doing it lying down, but if possible, standing up. So let's just start with a little shaking. I'm just bending at the knees, but my body's pretty relaxed. I'm not using muscles in my arms, so they're kind of like ropes shaking. Just really shaking a little bit, but relaxed at the same time. So around the world, still, before there's a social cohesive ritual, people often get up and shake like this. Or at wrestling matches, gentle shaking. Relax, close your eyes, feel the sensations in your body. When people are stressed, they forget about their body. You need to come back to it, feel what's happening. Notice your thoughts. Notice the qualities of your breathing. And opening our eyes, we have activating practices, we have calming practices. The coherent breathing optimizes every system measurable in the body and the brain. Okay, but we'll start with something you saw me do a little bit with the people in South Sudan, which is what we call Ha breath. It's found in many traditions around the world for healing. So we'll do the basic Ha. You're going to breathe in, elbows come back, palms up, and then you're going to go Ha from your belly. Okay. Now, if you cannot yell where you are, you can do a really strong inhale and a really vigorous exhale. But if you can let the Ha out and use your voice, that would be great. Breathing in. Ha! Ha! Notice I don't straighten my arms. There's a bend in the elbow. Breath in. Ha! 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 2 more. Ha! Ha! And relax. Once again, close your eyes. Where has the energy changed most inside you? Just feel what's happening in your body. Notice your thoughts, the kind of thoughts, the pacing of the thoughts. And you feel the rhythm that your breath wants to be in. So there are times you need to activate before doing something challenging physically or mentally. And especially when you want to absorb more information in a shorter time, there's a way to use breath to do that. And sometimes you want to get negative feelings out. So we've used this a lot in schools where the children are violent. And it's amazing the change that comes about as they learn to use this to regulate their emotions. Let's do something very common. And this is the breath that I teach first to veterans, because anger and trouble sleeping is often their biggest issue. So just follow me. We're going to breathe in for 4, hold for 4, breathe out for 6, pause the out breath for 2, and we're going to use movement. Just follow my movement. Breath in, 2, 3, 4, hold, 2, 3, 4. Breath out, 2, 3, 4, 5, 6. Pause 2. Breath in, 2, 3, 4. Hold effortlessly, 3, 4. Breath out, coming down, 3, 4, 5, 6. Pause, 2. Breath in. Observe your mind in the breath holds. Hold. Breath out. Pause, 2. Breath in. Notice we're working on the central core. That's what your interoceptive whole cortex represents. The feelings in the body. Breath out. 2, 3, 4, 5, 6. Pause, 2. One more. Breath in. Hold. 2, 3, 4. Breath out. 2, 3, 4, 5, 6. Pause, 2. Relax. Once again, closing your eyes. Notice your thoughts. Notice the pace of the thoughts, the space between the thoughts. Feel the sensations throughout your body. And notice the qualities of your breathing. How has that changed? And opening our eyes. And when people come with a lot of stress, it's important to shift them gradually. It's too much of a shock to take people out of stress too quickly. So we're just doing a short practice as a start. To learn coherent breathing, because it's the most important single thing we do, but it's a breath rate that's a third of what our typical breath rate, or even less. It takes help to get people used to it. So we pair the breath with a simple movement. I'm not quite sure the space that you're all in. So I'm going to pick what we do when it's a small space, like a bomb shelter, okay? So it comes from Qigong. It's called stroking or painting the waterfall. We're going to breathe in as the hands go up. And we're going to breathe out as the hands go down. Unbending the knees. You could do it with your legs straight, but it's nice to kind of get the whole body engaged in it. And imagine you can feel the waterfall on the back of your hands and on the front of your hands, and you may even see it in your mind's eye. Let's do it. Breath in, 2, 3, 4. Breath out, 2, 3, 4. Breath in, out. Breath in, 2, 3, 4. Breath out, 2, 3, 4. Feel the waterfall. Breath in. Breath out. Can your hands move like the waterfall, smooth and flowing? Breath in. And breath out. Breath in. Breath out. Breath in. Breath out. Kids really like this one. One more. Breath in. Feel the waterfall. See it. Breath out. And relax. Closing your eyes. Let your spine get longer, taller. What do you feel in your fingers and hands? What do you feel in your body? Notice your thoughts and notice the qualities of your breathing. And opening our eyes. So now let's sit. I'll invite you to sit or lie down. And we're going to really focus more on the breathing. So to make every system better that's measurable, we have to breathe for the person of average height around 5 or 6 breaths per minute. For taller folks, although which I teach a lot in the military of the US and other countries, we start at 5 breaths per minute, but they learn to go down to 4 and 3, depending a little bit on their cardio fitness. And so we're going to be doing about 5 breaths per minute. I'll pace you with my voice. And if possible, close your eyes. Highly traumatized, stressed people may not close their eyes fully for weeks or months. It's okay. But if you can close your eyes, it accelerates your body's learning what it needs to do. It turns on self-healing mechanisms. And the third part, besides breathing at the pace of 5 or 6 breaths per minute and really relaxing, is where you put your attention. And that's something that most people leave out. I'll be asking you to put your attention on feeling the breath moving in and out of your nose. And if possible, breathe in and out through your nose. So before we start, we'll take 2 deep breaths in and let them out with a sigh. And I'm getting some tones ready to help me pace you at the right rate. Um, so let's close our eyes and let's take a deep breath in. And let go. Breath in. Relax the muscles of your face, around your eyes, forehead, cheeks, and jaw. Relax the muscles of your scalp on the top and sides and back of your head. Relax your neck and shoulders, arms and hands. Let your spine stretch up again. But can you relax the muscles at the sides of your spine and around your shoulder blades? Relax the muscles between your ribs. Around your waist and lower back. Legs and feet. And just follow my voice, just responding. Breath in, effortless, continuous. Breath out. Breath in. When you breathe in, you don't have to fill your lungs. So relaxed. Breathing out now, you don't have to squeeze all the air out. Breath in, your belly gets bigger. Out, your belly gets smaller. Breath in, belly gets a little bigger. Breath out, the belly gets a little smaller. If you're going the opposite way, join me. Breath in. Breath out. Breath in. Breath out. Notice how you relax a little more when you breathe out. Breath in. Out. Feel the breath moving in and out of your nose and throat. Breath in. Breath out. Breath in. Whatever distractions come, let them float by like clouds in the sky. Breath out. Feel the breath moving inside you. Breath in. Breath out. Breath in. Breath out. And imagine a beautiful smile comes on your face. Breath in like you're 5 years old. You're playing with your friends, your family, having fun. Breath out. Breath in. Very gentle. Breath out. Breathing in. Let the distractions float on by. Breath out. Keep your attention on feeling the breath moving inside you. Breath in. Breath out. Breath in. Breath out. If the smile's disappeared, let it come back like magic. Breath in. Out. How does the smile change the quality of your breathing? Breathing in. Breathing out. Breathing in. Breathing out. Breath in. Breath out. Breath in. Feel how there's a little more energy when you breathe in, moving through your body. Breath out. Feel how your body can relax a little more. Breath in. Breath out. Breath in. Breath out. In. Breath out. Breath in. The breath takes you back to your real self. Breath out. Breathing in. Breathing out. In and out. Breath in. Breathing in. Gently, effortlessly, continuously. Breath out. Breathing in. Breathing out. Breathing in. Breathing out. Breath in. Can you imagine you are being breathed? Breath out. Let your imagination feel what that would be like. Breath in. Breath out. In. Just let your breathing go into whatever rhythm it wants to be in, natural. No need to control it with your conscious mind. Just allow it to be the way it wants to be. Can you feel what that rhythm is without changing it? Notice the sensations in your body. You may be able to feel pulses in places you usually do not, as the blood vessels get much more flexible, like a baby's. Notice your thoughts. Is there more space between the thoughts? Notice your feelings. Become aware of your body, your whole body, and the skin all over the surface of your body. Become very aware of your feet and toes, ankles and lower legs, knees and upper legs, your belly, maybe the internal organs, your whole torso, and the lungs gently getting bigger and smaller with your breath. Your arms and hands, shoulders, neck and throat. The whole head. And while feeling the space inside your body, feel the space of the room around you. Listen to the noises in the room you're in. And then beyond the room. And gently, slowly, when you're ready, you can stretch your arms and legs, your body, and open your eyes.
Thank you very much. This was very instructive and very relaxing at the same time. For those of you who are interested, Dr. Gerbarg and Brown will be giving a workshop tomorrow, 12 to 3 o'clock Pacific time. And you can register. There's an announcement going around. If you don't know how to access it, email me. And now we could interact and ask questions. There's one question already in a queue from Melissa Breimer. You partially answered this, but maybe you could elaborate. How do you adjust for those who experienced violence? I tend to not force the eyes closed.
Yeah, where people are, what we say to people is we suggest they close their eyes, but especially if we're working with a large crowd of traumatized people, we say, at least close your eyes part way, and you can look down in front of you about 45 degrees, because we're such visual animals. Looking at things around us tend to take us outside ourselves. And we want to bring people back to their real original self without all the masks that we wear throughout the day.
The next question from Dr. Cook, diaphragmatic versus chest breathing. Well, maybe you could explain a bit about it.
Well, what we find is if you start talking to people about diaphragmatic breathing, it's like talking to a centipede about how it should move its feet. It tends to trip itself over. And, what we find is just relaxing people and having them understand when you breathe in, your belly gets a little bigger, and when you breathe out, the belly gets a little smaller. It kind of takes care of itself. Some people take a little longer than others, but it's not so difficult. And I find if you bring attention a lot to their belly, they get all hung up about it and feel like they're doing everything wrong. Because people have a lot of tension who've been traumatized, and it's very hard to breathe in a relaxed way at first, but it happens very quickly, actually.
Question from Dr. Ames. Any experience working with people with POTS?
Oh, yes, totally. So the breathing is really helpful. Ha breath, as well as coherent breathing, and the 4-4-6-2 are very important. And also I recommend certain kinds of herbs as well, but that's another topic.
We have online our recordings from the time of COVID, where POTS is a big component of it. And Dr. Brown actually goes into the review of supplements and herbs. It's available on semel.ucla.edu/integrative mental health. Have you seen any benefits for post-COVID anxiety, post-ICU, and in particular residual cognitive impairment in older individuals post-above?
Yes, I would say that the post-COVID cognitive impairment, although it will be helped by the breathing, again, there are certain supplements, nutrients, and herbs that can help the brain recover from the inflammation from COVID. But absolutely, I mean, I think what I see a lot in practice is that we're overlooking both the physical and the PTSD consequences of COVID. And all the time people come to me having seen other medical doctors and psychiatrists, and most of it is coming from COVID. And I think everybody's trying to forget it.
Well, I run a post-COVID psychiatry clinic, so I can't forget it. It's still happening, and the severity of symptoms is not changing in vulnerable people, despite the fact that the symptoms of COVID are milder compared to 2020.
Right, right.
And in psychiatry, when we see patients, we typically don't ask about it, whether the people had COVID, but you might be surprised by the change in the disease course following COVID infection becomes treatment resistant. And so at least it's helpful to inquire about it.
Right.
So I want, unless there are other questions, any last questions? I want to thank you for the wonderful seminar and look forward to tomorrow's program, where you will go into greater details about the specifics and also background information, right?
And we'll go deeper into the practices, because again, people need to shift gradually. It's too much of a shock to detox them from stress immediately. So there each of these things we've done, we can go deeper, deeper, deeper.
All right, very good. Thank you very much again.
Thank you.
Thank you.
Be well.
See you soon.